In many states, nurse practitioners, like physicians, have the ability to assess and diagnose patients and prescribe treatments and medications. These individuals are becoming an increasingly valuable part of the healthcare team, as the U.S. is currently experiencing a physician shortage. Are you thinking of joining the field? Here are 7 things you should know about nurse practitioners. Demand is high. A March 2018 press release by the American Association of Nurse Practitioners reported that the number of nurse practitioners licensed to practice in the United States is at an all-time high. Right now, 248,000 nurse practitioners are currently licensed to practice, with more nurse practitioners entering the workforce all the time. More job opportunities. Increasing numbers of primary care practices are expanding their use of advanced practice clinicians. These include nurse practitioners and physician assistants. Healthcare is shifting toward a more team-centric and coordinated approach to providing care, and the increasing integration of nurse practitioners is central to this change. The Bureau of Labor Statistics indicates that between 2016 and 2026, nurse practitioners can expect to see a 36% increase in job growth. Scope of practice. Nurse practitioner degree programs provide advanced nursing education and clinical experience that nurse practitioners require in order to fully practice as a primary care provider in their state. With that said, each state's laws dictate a nurse practitioner's scope of practice. Depending on your state, nurse practitioners may be able to work independently or may be required to work under physician supervision. Currently, only 22 states grant full scope of practice to nurse practitioners. 16 authorize some practice autonomy with prescription restrictions, and 12 require nurse practitioners to practice under the direct supervision of a physician at all times. Primary care provider shortage. The United States is in the midst of a primary care provider shortage that is expected to increase through 2030. The American Association of Medical Colleges, AAMC, published a report estimating that by 2030, the primary care provider shortage could grow to over 49,000 physicians. When there is a provider shortage, access to primary care is poor for many individuals and families, especially those living in rural locations. Serving the underserved. Approximately 20% of Americans live in rural areas, and there are on average 13.1 physicians per 10,000 people, compared to 31.2 per 10,000 people in urban areas. Increasing numbers of nurse practitioners are working in underserved areas such as these. From 2008 to 2016, the percentage of nurse practitioners serving rural populations increased from 17.6% to 25.2%. According to a report by the United Health Group, nurse practitioners, along with physician assistants, have the potential to reduce the primary care physician shortage by 70%. Quality patient care. A study published in the Journal of the American Medical Association reported that after 6 months, no significant differences were noted in the health status of patients who had been seen by nurse practitioners as compared to those seen by primary care physicians. It's fair to say that nurse practitioners are every bit as important as physicians, especially in the light of the current primary care physician shortage, an evolving landscape. Whereas most nurse practitioners work in hospitals and other healthcare settings, family nurse practitioners typically work in outpatient or community medical clinics or practice in their own private clinics, treating patients throughout the life cycle, diagnosing illness, conducting exams, and prescribing medication. As the integration of nurse practitioners increases, the number and variety of job opportunities will continue to grow for both nurse practitioners and family nurse practitioners. By becoming a family nurse practitioner, you'll fill a critical role in healthcare that helps save lives. Ready to learn more? Check out our website to see how you can request information about the online family nurse practitioner degree and certificate programs at Carson-Newman Online, including an online RN to MSN FNP, MSN FNP, and Postmaster's FNP certificate. Our online nursing programs are designed for busy nurses, featuring no mandatory class login times, stress-free clinical placement support for MSN level courses, and unrivaled student support. If you liked this video, be sure to like, comment, and subscribe.